everyone. Welcome back to our weekly webinar series, Embracing Change.
Okay.
I want to thank you once again for the honor and privilege to be of service. And today we begin a series of webinars that are going to talk about our ability to adapt and move towards anti-fragility. So today we have an incredible human being, Dr. Michel Golay, who's based in Geneva. I met him a number of years ago. He won't let me call him by his nickname, which is actually the magician. So it has a lot of different connotations, we said, which he asked me not to use. But of course, I'm not good at listening, Dr. Golay. So he's going to talk to us about gut health and the adaptability and importance of gut health and brain health. But what I'd like to do is, Michel, since we're going to have a nice dialogue together, is give everyone a bit of a background as to how you ended up in this space, even though you're a chiropractor by training. So welcome, Michel. Thank you very much for taking the time from your practice to be here with us today. And please begin.
Okay. Hello, everybody. It's a pleasure for me to spend this time with you, and hopefully I will be able to share with you some of my passion in my life. And so my background, it's true that I went to study in Los Angeles chiropractic in the 80s, and chiropractic is a kind of strange because in one hand it's mainstream. In Switzerland, chiropractic care are part of the regular medical profession. And chiropractic is using a lot of so-called alternative care. So we are in the middle between the necessity to have a real diagnosis and using alternative care, which are quite often not as well demonstrated and not as precise in terms of evaluation. So, and during these studies, you understand, I understood right away that when you study medicine, and when you learn about diagnostic procedure, you learn about disease, you don't learn about health. So that there is always a big discrepancy between studying disease and trying to achieve health. And so myself, for the last 30 years, I really try to figure out, I'm a positive person in nature, so I always thought that we are built to be healthy. We are not built to be sick. All throughout evolution, our system evolved always to try to fix our weakness in order to us to stay healthy and to be able to create our own health. So that's been all my journey has been always to be on trying to find out what you need to provide to your body in order for him to function and to create his own health and not to get a disease. And so that's how, after my chiropractic school, in chiropractic school, the chiropractic philosophy is already okay. We've got all the manipulation of the joint, the cracking that everybody knows. But chiropractic is really a holistic medicine in terms that since 1920 they provide exercise, they provide nutrition. We had a lot of I think more than 700 hours of nutrition during my school in chiropractic school. So that was really the main core of the profession. It was always chiropractic care, exercise, and nutrition. And it's clear that the nutrition that we knew in the 80s is not what we know now. And so when I start to get into practice, I start to get into micronutrition, it's more than 25 years ago that I start to work with that. And we start to work with the first probiotic and all those kinds of things. And back then we didn't understand much about it. It was trying error and success. And little by little we developed the concept of the gut health. And what do you need to for your gut to function properly? And since the discovery of the human genome in the year 2000, there is a huge data that came out that now we really understand the main function of the bacteria of your gut, the microbiota, and the function that the protective function of the microbiota, the feeding function of the microbiota, and also the immune system activation or protection of the microbiota. And those three functions are very important for your health. So that's why I spend a lot of time with my patient to try to solve all the digestive issue they may have, and in order to have that good microbiota. So that was the first part on the gut. And on the second part, there was all the exercise part, exercise therapy. So I developed Athletica 22 years ago, which tried to provide specific exercise for all kinds of people with cancer, people with neurological disease, and to have a real impact with the physical activity. And in order to do that, I started to study functional neurology. And functional neurology tells us that the center of adaptation in your system, the center of adaptation is what we call the reptilian brain, or the other name of the reptilian brain is the autonomic nervous system. So that's how I start to focus a lot of my testing procedure on analyzing night, quality of night, how your autonomic nervous system respond to exercise, how it respond under stress. And now we've got the two pictures. I've got what I call the two brain concept, which is one part the gut brain, and the other part the autonomic nervous system, which is the center of adaptation. And then you've got to understand how your gut impacts your brain, and then you understand how your brain impacts your gut. So that's basically my journey.
But I understand that the information going from the gut to the brain is much more than the brain to the gut. Are you aligned with that, or is that?
No, yeah, there is around 100 million neurons connecting through the vagus nerve. There is around 100 million neurons, and there is 90% of the neurons are coming from the gut going to the brain, and only 10% going from the brain to the gut. But the brain, through the hypophysis, activate all the endocrine system, which is also another way to feed, to send information to the body. So it's not, as far as neuron, it's 90 up, 10 down, but the brain has also other ways to activate the hormonal system.
Okay, so let's go very basic, right? So in terms of the gut, what are the key elements that can help us? I mean, there are people that already have faced colon cancer, people who have Crohn's, people who have colitis that are watching. But then there's those like me, for example. When I'm stressed, the first thing that goes is my gut. Okay, that's the first thing within minutes that goes. So what are the basic things that you can share with us first to how do we protect, right? Now, I know there's a lot of people collecting their microbiome today, right? And I went to Singularity and, they're collecting on a daily basis. And that's a different conversation. So what are the basics? Why don't we go through very gently?
So the very basic, the most important is microbial diversity.
Okay.
We should have around 1,000 different species of bacteria in your gut. And everybody with chronic disease, with ulcerative colitis, we lose the obesity, diabetes, hypertension. The number of species dropped from 1,000 to around 500, 600. Okay. And that's a big issue, because if you get less species, some of them will take power, right? The impact of each species can be bigger than the other one. To me, there is no such thing as bad bacteria. there is no such thing as good bacteria or bad bacteria. The bad bacteria is the one that your body lets grow. Okay, it's the same with the virus. There is no such thing as a good or bad virus. Is your body able to keep it under control? And the diversity of the bacteria in your gut is essential for that.
Okay, so for those of us who reached 500, or those of us who want to avoid having 500 to 600, what can we do to support ourselves?
Okay, so there is the two aspects. There is the nutritional aspect. The nutritional aspect, it says the food, the specific food for the bacteria are fibers. Okay. The dietary fibers are the main key. There is 5 categories of fibers, and what happened in the Western environment is that we process most of us eat a lot of processed food. All those things have a tendency to remove the fibers, because the fibers are harder to chew, and they change. It's not as sweet in your mouth, and so it's not the most attractive food for us. And so the industry try to sell their product, and they want to make us addict to product that have no fibers. We should eat 55 grams of fibers a day, and the average.
So what does that look like? What does that look like? What does that mean? What does that mean? Like, what do I have to eat?
55 grams means it's a lot. The average westernized diet is between 15 and 20. Okay. So it's true that where do we find the fibers? We found it in cereals, we find it in vegetables, we find it in fruits. And it's true that most people we eat the diet are mostly on meat and on wheat that has been where all the good things have been removed, and so the big problem is that. So we really have to bring fibers.
So to get that, how many portions is that of fruit and vegetables?
That would be, they tell us always 5 portions a day for vegetables. To me, it's at least 10.
Okay, so 10 portions. So, okay.
At least it should be 10 portions a day to make it to have a chance to reach that. But you've got to be, if you've got a poor diet, if you take it right away 10 portions, it's not going to make it. You know, it's going to create you a lot of symptoms. So you've got to increase progressively. You cannot go right away from 2 to 3, which is the main things, to 10 or something like that.
Okay. So you mean the digestive system will react if we go so fast?
Exactly.
Okay.
Because you've got to give a chance to the bacteria to grow and to adapt to the new process.
Because most people who already have issues in their gut, when they start to eat these vegetables, as you were talking about, the body reacts immediately. So slowly and progressively, you decrease.
In medicine, there is what we call the food map diet, which basically remove all the fibers. But if you, which is to me, it's a nonsense. But it's true that if your gut is not working at all, just a little bit of fibers will create symptoms. But on the other hand, if you want to get well, you've got to be able to retrain your system to be able to digest the fibers.
So would you say increasing 1 portion a week as you go, or every other week? What would be the progression?
And then you can use pre and probiotic to help you along the way. And you can use that, so you reinstore some kind of bacteria where you lost the function, and then you feed them with prebiotics, so you don't really have to increase as many portions, but you just feed with the proper fibers. That's going to help the implementation of the probiotic that you give. And then little by little you switch from pre-probiotic to just nutrition.
But the absorption, what about the absorption of the pre and probiotics? How well is it absorbed, or is it case by case? The absorption.
the probiotic.
Yeah, the absorption of it. Yeah.
The absorption, we don't. If the probiotic is well chosen, because now we've got probiotic for your mouth, you've got probiotic for your stomach, you've got probiotic for your duodenum, you've got probiotic for the small intestine, you've got probiotic for the large intestine with different function, and we can really. There is at least myself, I'm using between 15 to 20 different kind of probiotic.
Okay.
Which are, but then you've got to pick up the right one that your patient needs. And most people just give a general probiotic, and the general probiotic have an effect on the large intestine most of the time. The one that the most commonly sold have an impact either on constipation for improved transit or decrease transit, and they've got an impact on the large intestine. But most people have issue with the upper digestive tract.
Okay, so out of the 1,000 bacteria, it's all over, or is there a concentration more in the large or the small?
In every part, the concentration change. In every part, the pH, the acidity, basically the acidity of the gut change from one part to the other. So it's very important that the environment of bacteria depend on the temperature and on the pH.
Okay,
and
so coming to pH. Yeah, so
the pH is the acidity or is it, and each part of the gut needs specific pH in order to do its job properly.
So for example, myself, I have. Yeah, go ahead.
The pH of the ascending colon is different of the pH of the descending colon. And the pH of the ascending colon allows the absorption of the sugar, and the pH of the descending colon allows the absorption of proteins. So
how do we improve that the pH level is in the optimal state? What do we need to do? What can we do?
There is some blood exam that give you indirect value, but the main evaluation is history. Is speaking with the patient, knowing what kind of symptom he's got at what time, when does he get bloating, not bloating, is it maybe just after the meal or 2-3 hours after the meal, when do the symptoms arise and when do they go? And at this point, it's more history-taking findings. Because you're mentioning before the analyzing of the microbiota, the DNA that's taking the stool and analyzing the bacteria of the stool. To me, I'm not convinced at all about that way of measuring that, because we measure what's coming out and the bacteria traveling in the lumen of the gut. But what are the bacteria that are very important are within the folds of the guts, and those are not the same population. And I'm actually I tried to work with a company for 6 months doing this kind of things, and the result of the DNA testing of the stool did not provide that, because if the problem is in the stomach, I'm not sure that 12 meters further is valid. So I've got really doubts about that.
So now so we've talked about the acidity level, the pH level. We talked about the gut, the 1,000 bacteria that we can help through fiber. Now, why are these important for adaptability to well-being? Like why is it relevant?
So the diversity, if you've got diversity of the gut, of the bacteria of your gut, you've got to understand that the bacteria, what you eat, what you get in your plate is not what you get in your body. The bacteria eats before they've got a chance to eat the food that we ingest before us. So more than 50% of what we eat, actually we eat the leftover from the bacteria. So there is a big transformation from the first things is that the bacteria transform what we eat.
Okay.
So that's why it's important to have a good variety, because otherwise they feed us always the same, right? You eat a very diverse diet, and if there is not that many bacteria, they would always feed you the same. You eat spaghetti all the time. That's the first thing, that the feeding function of the bacteria. The second thing that is very important is the bacteria produce a lot of substance that are hormone-like substance, if you like, that they produce that affect receptors on the intestinal wall. They produce a substance that get into our system. They produce that and activate our body. They produce substance that will have the ability to work actually to affect the expression of our gene. It's what we call epigenetic. So the bacteria, we live in symbiosis with the bacteria. And that's why those bacteria, the diversity of those bacteria is so important to have the good feeding and the good signaling system. The bacteria are the signaling system to your body cells and to your brain. They send information to the brain all the time. We've got to realize that we've got 3 square meters of skin. We've got 30 square meters of pulmonary lungs, right? But we've got 300 square meters of guts, and that surface area represents 90% of the contact from us with the external world. Knowing that the gut is the external world. So that's why it's so important.
So in terms of epigenetics, you're saying that the epigenetics the impact on epigenetics from the gut, is it the most, is it the majority, or is it just one of the key players?
I think it's one of the key players for sure.
And what is it sending to the brain? You're saying it's sending messaging to the brain. Of what kind of messaging is going to the brain?
So there is messaging through the activation of the receptor of the gut that will go through the vagus nerve going up to the brain. So that would be the neurological activation, if you want. Okay. And they produce prostaglandin. They produce all kinds of substance that go into the blood, and that are able to go in all over the body, including crossing the blood-brain barrier.
So
they would have an effect on the brain itself.
So in terms of all these new neurological diseases that are coming, right, that have all showed up, well, at least assessed and understood, well, not really understood, but Parkinson's, dementia, Alzheimer's. A lot of people are talking that the gut is the area that is actually, I'm not saying creating it, but the weakness of the gut is a key contributor. Are you in alignment with that, or is that still talk?
Maybe not for Alzheimer.
Okay.
But for Parkinson's disease.
Okay.
I think we can now the scientific. We've got basically the scientific proof that Parkinson's really starts into the gut. Okay. Most likely, MS is also part of it.
Okay.
Multiple sclerosis is also along the same line. Alzheimer, I think it's more complicated. It's more complicated than that. I'm not sure. It's probable that there is an effect for sure, but I don't think it's the same link than Parkinson. Parkinson is really well connected with the gut function.
So what are the symptoms that you have seen for those who ended up with Parkinson's? What were the first symptoms that they initially had?
The first symptom of Parkinson is constipation.
Okay, so how many years before Parkinson's actually develops are they?
Somebody that goes regularly as normal bowel movement, then start to, and I guess to develop the first symptoms, real symptoms of Parkinson, it means that you've got to lose 50% of the neuron in the brain. Huh? Wow. Before that, the brain is able to adapt. So so the constipation will take at least 5 to 10 years but getting worse and getting worse, and then it will destroy the brain, the substantia nigra of the brain, and then but you need 50% of the disappearance of the substantia nigra before to have the first symptoms of Parkinson's. So,
so
the brain is able to adapt fantastically well for a long time.
Okay, but 5 to 10 years is not very long as far as I'm concerned. So you start getting constipated. What else are you seeing? Are you seeing any other symptoms, gut related or brain related? Because you're going to talk about brain performance as well. Right?
The brain. So to go over the brain, the brain relation would be the first sign of Parkinson would be difficulty of tracking object. When you look at you track an object in the sky, you would have difficulty to track that.
Okay.
And the kind of sluggish ability to focus on tracking object in the space. That would be the first sign.
Okay, so is it now the constipation? What is it doing? Is it the messaging going to create that sluggishness, or is that a separate story altogether?
Usually the constipation creates production of substances that goes into the brain that will create inflammation into the brain, specifically in the area of the dopamine center production, and which will basically little by little produce substances that will make those cells die, and when the cells are dying, then they are not replaced, and then little by little you lose them.
Okay, so there are people obviously that are listening that probably have been constipated for many years and have been using different methods. What would be your recommendation to them in terms of, it's more important to not be constipated, but then what are the interventions that they should do that are safe and not counterproductive, right, in the long term?
To me, constipation is way underlooked in medicine, and it's true that it's very important not to be constipated, because you've got to understand that with constipation and slowing down of the transit, you really get a lot of substance have a tendency to oxidize in the gut, and all the substances that are oxidized, if it goes too slow, oxidized substances cannot be absorbed anymore. It's the case of all the minerals. It's the case for iron. It's the case for tryptophan. All that helps to produce serotonin. Is the case for tyrosine that helps to produce dopamine. That's all those substances. If they are oxidized, they cannot get absorbed. And so typically it's constipation is more common in women than in men. Much more common.
Reason or any specific reason, or
it's like 5 to 1 or something like that. The ratio is much more. Much more. The prevalence of constipation is much more in women, and typically all those women have low iron.
Yes.
Because the oxidized iron you cannot get in. And so, and if they get low, they get fatigue, they get low level of tryptophan, they get low level of serotonin, they cannot sleep well, and the whole energy level is not right. And if you get fatigue,
if you
get fatigue, you've got a tendency to eat more, because you feel fatigue, so you feel that you've got to eat more, and then you gain weight, and the whole vicious circle is a whole vicious circle. So to me, it's true that it's very important to be able to normalize the gut function is very important for me.
Okay, so what do you recommend? What should they do that will long term be not counterproductive?
So it's a probiotic and prebiotic, fibrous and bacteria. You choose the right probiotic, you feed those bacteria with the proper fibers, and you normalize that, and it works. It works very well. And it's true that people that are having constipation for years, they've been trying, most of the time they've been trying a lot of drugs to help them to go, and those medication usually affect the neuron that helps the transit, the peristaltism of the gut.
Spasm, yeah.
And but it's not a good way to do it, because then there is less over the years. It's less and less effective. The drugs are less effective, and the gut is more and more lazy. And sometimes it's very difficult to solve the problem. But with good probiotic and good fibers, most of the time we get that very easily.
Okay, so now if we move on, any other elements, and then we move on to the brain. Anything else you want to share on gut and adaptability?
At the beginning, we were asking me what could affect the gut's health, and so I speak about nutrition and bacteria and oral bacteria. But the best way to improve digestive function is exercise. Okay.
Let's talk about that. Okay, so what types of exercise? What do you recommend?
Because exercise will work on the when you do exercise, you don't train your muscle, you don't train your heart, you don't train your lungs. When you exercise, actually you create a big activation of the autonomic nervous system, and then that the response of the autonomic nervous system will lead to adaptation to all the body. And the amount of gastric HCl that is produced, the amount of digestive enzyme produced by the pancreas, the amount of bile produced by the liver, is all determined by the autonomic nervous system. Okay. Those are information that are sent from the brain to the gut. So that's why exercise is as effective for me as nutrition to change the gut microbiota, because you change the ability to digest, you modify all that, and it's a big trigger to improvement.
But now exercise, there's a diversity, right? So for example, I play tennis, I swim, and I trek, and I do yoga. Now I don't do strength training, for example. I don't, so what do you mean by exercise? I mean, what does it mean?
So exercising, the food is the nutrition for the bacteria, and exercising is the food for the brain.
Okay.
And the brain doesn't want to eat pasta every day. It wants to also have variety of food. And so it's true that you've got to try to provide as much variety as you can. And if you do track, tennis, yoga, so it's already three different kinds of food. And so it's true that it's very important to have that diversity. And strength training, up to now, a lot of people have always tried to develop the muscle mass, right? When you think strength training, you think to become to improve the muscle mass, but the muscle mass is useless for health. What is important is to improve.
That's a strong comment, Michel. Okay, go ahead.
No, because what you've got to understand is that the best way to improve strength is not to improve the size of the muscle fibers, is to improve nervous system function. Yeah. The coordination of the neurons from the brain to the nerve. So you've got to do activities that improve the function of your nervous system.
Okay. So how does meditation play in? Because meditation is the parasympathetic and sympathetic nervous system. So how is that a player? Is that also what you call exercise, or is that a different part?
Meditation works at the cortical level.
Okay.
Works on the cortical level, and the reptilian brain is underneath the cortical level. Okay. And we talk about the 90% of the fibers coming from the gut and 10% going down. You've got to understand that 90% of the cortical fibers are heading on the autonomic nervous system.
Okay.
And those 90% of fibers 80% of them have an inhibitory function on the autonomic nervous system. That means when you do meditation, when you do all those the brain activation and trying to slow down and see, you will increase the control over the autonomic nervous system, which is very good. Okay. Especially if you're on a burnout, almost burnout stage, if your life is crazy, and then your autonomic system has a tendency to go in all over the direction, meditation will help you to control that. But with meditation, you're not going to improve the health of the autonomic nervous system itself.
Okay, just balance.
You've got the control,
so you're just gonna balance it.
But
okay.
the health of the autonomic nervous system is to increase the network of neurons, the interaction of the neuron within the autonomic nervous system, and this cannot be done. It can be done only through exercise.
Okay.
It cannot. Both are very important, but to me, all the meditation, all those the spiritual activities are very important. To when you're in a bad state, you can control that well.
Yeah.
But you've got to do exercise to improve the function itself, and then eventually, if you get strong enough, you may not need to do as much meditation. You may not need to do as much sophrology or relaxation technique, because your autonomic system is going to be strong enough again.
By itself. Okay. Okay.
But
I'm still going to meditate, but I'm not saying. I'm just kidding.
No, but then to me, it's very important. We all have routines.
Yeah.
Routines of your life. You've got to find your routine to be healthy. You've got to find those routines. Yeah. But you've got to understand why you're doing them.
Yeah, exactly.
And if you do it because you like it, it brings you joy. You've got to do it. Yeah. It's very important to do things that you like. Yeah. But you may not have to do it all the time, and I don't think it's right to do things all the time, because like mechanical
like
things.
Yeah, like a machine.
And it has to be done on the good amount and for the good reason, and we've got to understand both.
Okay, so we've got the nutrition side, we've got the exercise side. What else? What other element? Now we go to the brain, or is there something else?
What about the main ways the third ways to affect the system? It's always you've got to understand adaptation is done by the brain, but it's through and we've got all the feeding information. I talk about the bacteria of the gut and the 300 square meters of the gut, but the smell is all the information that get into your brain. All the sensory system are important, and that's why also manual therapy, massage, chiropractic, all kinds of all the manual therapies are ways to feed the body and feed the brain with information.
Oh, okay.
So and actually manual therapies is exactly like exercise. We work on the same receptors. When you exercise and you move your arm, you activate receptors of the joint. You activate it, then it feeds your brain and gives information to your brain. When I do vibration on my elbow, I stimulate the exact same receptors.
Okay.
And it's also one way to stimulate the brain and to stimulate the autonomic nervous system. So all the manual therapies, and again, there is all kinds of manual therapies, and if you do manual therapies, you should also do different kind of manual therapies in order to feed differently, to have different stimulation to your autonomic nervous system. Then you will get those the results.
So would you recommend doing what we call bodywork or manual therapy once a week, twice a week, like what, and move through different things?
Again, it depends at the beginning. It can be more often, and again, once you get well, you figure out what is the good time
balance.
frame in between two sessions. But it's true that to have a good body work and at the right part to stimulate the good part of the autonomic nervous system, that you've got a tendency to have weaknesses, because we all have a tendency to have some. You've got your own weakness and I've got mine, and so we've got to be able to understand which one they are and what we can do to try to balance them.
No, because most people, I mean, one is massages is to move through, right? Move through the energy. Mm-hmm. But a lot of people are also doing body work as a protective measure, right? Because they're pushing their bodies, whether through sport, whether through workout, they're doing it to make sure they're protected so that they don't end up with injury. But what you're talking about is a very different story. You're not talking about defense. You're talking about offense, right? You're actually doing it for a very different reason.
I'm doing it not to protect. I'm doing it to create health.
Yes, yes.
And it's true that people that pushing too much their body, it's a mistake. We are able to measure what is the right amount of exercise for you. For each individual, we can individualize the amount of exercise that that person is able to do, and we are able to measure the impact of each training session and how many days it will. If you push yourself a lot during one session, it may take a couple of days or 3 days before you recover from that session.
Yeah.
And if you don't wait those 2 or 3 days and you do the same session within that fatigue period, then you, instead of doing yourself something good, you do something bad.
So when personal trainers, I mean, there's a lot of personal trainers out there. Do they really understand that? Are they really taught these elements? Because I've never heard of. I hear the alternate day. I hear all these different techniques, but I've not had somebody specifically go through and explain this part you need 3 days. This part you need this many days.
We can measure that. There is, if you want to improve with exercise, you do a training session. The next days or couple of days, you've got to recover, and then for the next, then you get back to the same line that you were at the beginning, and then for 48 hours, 2 or 3 days, you're above. We call that hypercompensation. So you get above the initial state, and at this point that you've got to repeat your session. Okay. If you repeat the session, then since you improve, you're above the initial stage, you do it. Then you've got the last, and then you've got the line going up, which is means progression, which means that your body had to at the time to adapt to the initial training session. You give the time, then you can redo. And then you can change the load, and then now there is ways to measure where you are within that, and if you got a good personal trainer that is using heart rate variability analyzing, you can figure out that, and you know very well what to do. And during the 2 or 3 days where you're under, it doesn't mean that you don't do anything. You've got to do different type of exercise that are not using the same type of exercise. So you change. That's why it's important to change activity and do different kind of stimulation. And then you work from one kind of activation to the other, and we build the patient's health through that system.
Now, what about other exercises, mental exercises? Games or calculations or other kinds of stimulus. How does that play a part in exercise?
So it's very important. All the cortical activities, the cortical activities are very good, and your ability to respond fast and to have a well activated cortex, especially the frontal lobe, is very important for performance. You cannot concentrate. If the cortical activity through meditation, you're going to improve the cortical function a lot, and so they're going to be much more efficient in order to keep your concentration, to keep all those things are very important for that. And so the more fluent the cortical activities are, which you do work that with meditation, with all kinds of exercise, mental exercise you can do, the better the control on the autonomic nervous system, but the better when you ask for a specific task, the better the response is going to be.
Yeah.
And it's true. And now it's even possible to I've got the new tools now that I can measure the area of the cortical brain that are working best or not that well, and we can give specific exercise for certain part of the brain, and or stimulate slow down some part, excitate some other one, and try to move from that.
So we've covered now 3 things. Anything on the brain side other than, so these are the 3 we talked about, right? So all of these are impacting gut and brain health. Yeah. Any other, I mean, I'm just trying to see if there's any questions saying how to choose the right prebiotic, probiotic. Obviously that's, that's the $1 million question.
So we talk about the probiotic, choosing the one that is going to affect the area of your gut that is not working well. And as I mentioned before, it's more through history taking and talking with the patient's symptoms to figure out that. To me, it's more that's the most important one. Okay. And also some blood test results that helps you to correlate that. So that's for the probiotic. For the prebiotic, actually we should have out of the 55 grams of prebiotic that I mentioned that we should ingest, there is 5 categories of each fibers, and the ratio of each of them is slightly different. So again, depending on the symptoms, you're going to be able to try to figure out which one is the best. But a general prebiotic it works well. Most of the time, it works well.
Okay.
If you take a mix of
So myself, how does emotion play a part in this? So for me, when I'm stressed, like I said, the first thing to go is my gut. So what is the heart, the emotion, stress, feeling? I mean, obviously now with what's going on, you must be having patients who are.
Yeah. So once you're stressed, okay, your cortical function decrease. Yeah. And once then you decrease the control over the autonomic nervous system.
Okay.
And your response, because you are depending of the states, of the state your autonomic
nervous system is,
your response is going to be increased sympathetic activity.
Yeah, exactly.
And that increased sympathetic activities, in your case, is going to increase peristaltis. Yeah. And the increased peristaltis will lead to increase the trips to the toilet.
Yeah. So is that something you see regularly?
Yeah, very common.
Very common.
But again, it's because your autonomic nervous system is healthy enough. Because once you remove the control of the cortical function of the autonomic nervous system, if your autonomic nervous system is very strong, in the first phase is going to be hyperactive. People feel indestructible. They can feel they are never tired. They can feel they can do whatever. They've got no limit because the autonomic nervous system is very strong, and for quite a while it can go like that. And little by little, if the autonomic nervous system is not keeping under control, it's going to get fatigued. And then you've got different kind of symptoms. Then you're not hyperactive anymore. You start to go down, and all the functions start to decrease. And then you go down, and then you lead to the burnout, where all the function are not very good.
So right now, during this 3-4 months of this interesting experience that we're all having.
It can go over months and years. Huh?
I know, but right now, what have you seen the most right now in the last 3 months that we all experience this incredible?
It's amazing the increase of the anxiety level. The anxiety level is really increased a lot with the COVID things.
But are you seeing the impact on the gut? Are people getting?
Oh yeah, it's impacting everything.
Because so you're seeing people with injuries, back problems.
As soon as you increase anxiety, you decrease your quality of sleep.
Okay, so that's the first thing you're seeing.
Okay. Once you decrease your quality of sleep, as a chiropractor, the first thing you see is that the muscle system cannot rest properly. If the muscle system cannot rest properly, after a few days, weeks, you get aches and pains. Then you block yourself. Then you got musculoskeletal issue.
Okay.
And so that's one aspect on the body, right? Yeah. Then on the gut part, depending on the health of your autonomic nervous system, you will have a different response. But you will have a response. And then on the mental side, you will see aggressivity, you will see impatience, you will see all those kind of behavior with other people that are not right? That are excessive.
So are you, I mean, as you see now, we're living longer and longer, right? Mm-hmm. So do you see that as a very challenging element in terms of keeping the gut health, keeping the brain health? I mean, obviously we're seeing all of this, like we talked about, okay, we talked about Parkinson's mainly, but all the other elements. So what do you advise those who are, let's say, above 50, 60, 70, whatever the age is, what do you advise? Because we're all living much, much longer. So is that a big risk, or can we sustain it?
We know that the older we get, we've got most of people develop chronic small inflammation in the system, especially from the gut. We see change in the gut microflora changing over the years with developing of bacteria, increasing of the species of bacteria that have a tendency to produce inflammation.
Okay.
So we've got to me if you want to do the anti-age type of medicine, I don't like the word anti-age at all.
Yeah, we just want to be healthy.
To me, it's aging well. Aging well. Aging well is it's good to get older, and because you get wiser, each age should be a great age. So aging well is fine. And so it's true that with proper food, proper exercise, physical activity, and once in a while good probiotic, you should try to slow down as much as you can the change of your microbiota, and try to prevent as much as you can low grade inflammation that is the most common thing when you get older.
So what are the foods, maybe go back to nutrition for a minute, what are the foods that you would recommend to avoid or to minimize that create the inflammation? I mean, most of us are looking at gluten, looking at sugars, looking at wheat. I mean, what are your thoughts?
Those are all the basic food. We've got the basic and acid food. All the basic food will be protective towards so all the veggies, all the vegetables are basic food. All the cereals are basic food. The things to avoid, the food that are the most acidic one are the very old cheese. The drier the cheese, the most acidic function it is on your system. But again, it's always the same. Food diversity intake, creating diversity of the gut, of the microbiota, and then
so you're not against gluten. You're not saying dairy should be minimized. Any of
I'm
these
not
things?
against gluten because gluten has been there all the time, forever.
Oh, but the quantity it's 5 times more, right?
The issue with gluten again is a problem of industrial
Exactly.
industry,
It's 5 times.
because they add they take the normal cereal and they add the gluten in order to make the bread faster and things like that. So
Yes.
to me, if you can make somebody good bread without any gluten add in the flour, you won't have any issue with the gluten.
Yeah. Yeah, but it's very difficult, right? I have friends who have access to the wheat that was grown 100 years ago, but most of us don't have that access. So a lot of us just avoid it, right? So,
exactly.
But that's also an issue, right? What about dairy? What is your feeling on dairy?
Dairy is the same. If your gut is functioning properly, you don't have any issue with that. But we got dairy. There is 2 issues with dairy, right? There is the lactose.
Yeah.
The lactose, the enzyme to cut down the sugar of the milk, and there is casein, which is a protein. Basically, it's like casein is the same issue than gluten. It's a protein that is very much creating allergic reaction, and that can create problem. So for the lactose things, for the lactose problem is true that all the people from the East, all the blacks, all are on 100% dairy intolerant because they are breastfed, and then there is almost no dairy in their diet, so they lose the ability. In the Western, especially in Switzerland, where we love cheese, and the dairy industry even said that the milk does your body good, right? The good advertisement, and we are a country that eat a lot of dairy products.
Yes.
And in Switzerland, it's slightly different because you've got to understand that if you eat bacteria, if you have bacteria in your gut that are able to digest lactose, even if you lose your ability to produce the enzyme yourself, the bacteria that you've got in your gut will be able to do that at least for to some extent. So myself, people that are lactose intolerant and that really love to eat dairy product, I put them on a diet where they drink kefir. You take a milk, you put some bacteria in. It's a probiotic.
Yeah.
Those bacteria eat the sugar of the milk to grow, and then you absorb that. And then you bring bacteria in your gut that are able to digest lactose. And then after 2-3 months, those people get some degree of tolerance to lactose again. So it's able to, we can very much solve your lactose intolerance if you like. You have to. We can live without dairy as well. So I'm not saying again. It's a question of what you want. If you really love cheese because you're born in Switzerland, then it's good. And then in Switzerland, in most food they put dairy products, so it's difficult to avoid them. So
all right, we have just a couple minutes left. We have one question, and then if we can give us some closing remarks. So one, intermittent fasting, right? Many of us are doing intermittent fasting at least a couple times a week, if not more. What is the impact on the gut, the brain, and the system in terms of your experience? Is that something you recommend? What is your view on that?
The intermittent fasting is really the trend at this point, for sure. I think that intermittent fasting is good in the sense that it puts at rest the gut. And the fact, every time if you've got an inflammatory process going on, to put the gut at rest will make the inflammation decrease very drastically, very rapidly. So that's a good way to put the gut at rest.
Yeah.
And to slow down the inflammatory process. But again, for me, what I want to achieve is health. And
Yeah.
when health to me, the definition of health for me is adaptation. If you're healthy, you're able to adapt. That we should be able to be strong enough to be able to keep your body able to do whatever he wants on the maintaining the good balance with everything. But so on the to me, if you get to do intermittent fasting for the rest of your life, it's not good. It means you're
playing defense. Basically, you're saying you're playing defense because you're cooling it down.
Exactly. Yeah, exactly.
So it's not offense.
You protect yourself, but you don't develop your health.
Yeah. Okay. Closing remarks. What we have, we're out of time now. Michel, what are the closing remarks that you'd like to share?
It went fast.
Yes. I mean, I know we could spend hours, but tell me what are some of the things? I mean, I know we talked about nutrition. We talked about exercise. So what are the elements? I mean, anything you want to share to wrap up?
What I want to share is that we've got to each of us have to figure out what are our strengths, what are our weaknesses in terms of health. We've got to figure out ways to assess them as much as we can. And we've got to ask ourselves all the time, how much energy do I put in my health to improve my health? How much exercise, how much energy do I put to enjoy my life? What is enjoying your life? And that's all. Then we get into philosophy, and then we get which we didn't talk at all because which is very interesting for me, and it's another subject completely. What makes you? Why do you take care of yourself? What do you want to achieve with taking care of yourself? To me, taking care of myself helps me to take care of the people around me. Taking care of myself, it's brings me happiness within myself, which hopefully I can give to people around me, and especially the lovely one. And so that's where, to me, the main thing is all about that. The happiness in life is relationship, in my opinion. And in order to be able to connect with people, to be able to receive what people are offering you, you've got to be well enough within yourself to do it.
So I think we already have another topic, Michel, for our next webinar together, which is going to be why even bother to take care of health, right? What does it mean? What is the purpose? What are the benefits? The internal health, the external health. Today we talked about gut and brain, but I think it's a good start, right? Because a lot of things you shared, I mean, I know a lot of it I was not even aware, and I'm sure it was a very great benefit to everybody listening. So thank you very much, Michel. Really, today we started our first webinar on adaptability. Next week, we have Dr. Mikra Hamilton coming in to talk about anti-fragility from a physical, mental, emotional, and relational perspective. And the week after, we will have Henry coming in to talk about anti-fragility of families from a business and a family perspective. So we're really going into that whole space of adaptability, which is beyond even embracing change, but to make ourselves much stronger from this experience that we're having. So thank you very much, everyone.
Thank you very much.
Time. And Michel, once again, truly an honor and privilege. And let's organize another webinar in some time to discuss more on the philosophical side. Why bother, right? Why should we? Okay. Thank you, everyone. Thank you, Michel.
Thank you. Bye-bye.
See you next week. Okay. Bye-bye.